My name is Cassie Fournier, and the topic that I chose for my research paper was the advancements in medical technology. I primarily focused on the positive and the negative aspects within this and really kept in mind that without the advancements in medical technology, patient care would not be the way that it is today. Prior to the 20th century, death was a very short process. Children would often not live past the age of 5 due to their immune systems being underdeveloped. This was because if a child under the age of 5 was to contract a disease, their bodies would not be strong enough to be able to fight off this infection. Because of this, antibiotics were developed to be able to help boost a person's immune system to be able to fight off the infection within their body. This often led to children being able to fight off this infection and be able to live a long and healthy life. Back in 1955, a virus struck the nation very hard. We call it polio. This was a disease that firstly presented itself as the flu, which is what we're sort of experiencing now with COVID-19. This virus ended up progressing to something much, much worse, which is also what we're seeing presently. Polio often led to paralysis, which would lead to difficulty breathing. And doctors didn't really have a ventilation system in place to be able to help their patients breathe properly. With the advancement of the iron lungs, patients were able to breathe, and often when they were placed within these iron lungs, they were not able to get out of them. This was because their paralysis had set in, and now they were lifelong on the iron lungs, which debilitated a patient significantly. Because of this negative impact, doctors ended up developing several other ventilation systems. Most include CPAP machines, BiPAP machines. Those are primarily used for sleep apnea, which is when you find out that you have a difficulty breathing while you're sleeping. And sometimes you often stop breathing while you sleep. BiPAP machines are also used when a patient's oxygen saturation has become too low and they're not able to get it up with the normal oxygen via the nasal cannula, which is the plastic tubing that you normally see patients have in their nose that wrap around their ears. Those can go as high as 6 liters of oxygen, and sometimes patients are stuck on 6 liters of oxygen and they're not able to come back off of it. But however, this means that a patient is not debilitated with this oxygen system. With the iron lung system, a patient had to be laying flat on their back and having a machine breathe for them the rest of their life. Another ventilation system that's in place now is the face mask ventilators, the manual resuscitator bags, which are normally used during code statuses when a patient can no longer breathe for themselves because their heart has stopped. When chest compressions are being given, the resuscitator bags are placed over the patient's nose and mouth so that you are able to breathe into a patient's lungs for them while giving CPR. Another one is the tracheostomy ventilators. This is where a hole is cut into your neck and a tube is placed. This is so that a patient has a direct way of breathing, and often they're able to be taken off of this system as well. The negative aspects within medical technology are actually the hospital networking system. I have learned this by working. I work as a medical scribe in the emergency department. So I have seen firsthand that not all hospitals are on the same system and never really realized how much of a pain that could be. Because of this, hospitals are not able to all have the same medical records that are on file. And this makes it difficult for anybody who's trying to update a patient's history and make sure that their entire surgical, medical history, family history are all up to date. Another one is telemedicine. You might not think that it's a negative aspect to the advancements in medical technology, but I believe that this one is more of a personal negative aspect for myself. I find this negative because a doctor is now not able to physically touch his patient, and he's not able to see how the patient is acting in person. He's only able to see over a screen. While I was training for telemedicine, I was able to find that a doctor would be called in and had to basically Skype or FaceTime and be put on a drone sort of thing that you would roll into a patient's room. But because the doctor was not able to put their hands on a patient to be able to feel where a patient's tender in their abdomen or how fast their heart rate is going accurately, a nurse would have to go in and be present to be able to fully describe what their patient is feeling. I personally find this negative because I feel like a doctor is not able to fully diagnose their patient properly without being able to see them in person. I know that this isn't really a topic that most people think about, but I hope that you really think about the positive and the negative aspects within technology and not focus primarily on the negative aspects of technology within adolescents or children. The advancements in technology is really important in the medical standpoint, and I really hope that this is a big takeaway. Thank you for listening.